OakChart helps me as a physician in many ways. With OakChart, I can have access to the patient's hospitalized chart, whether I'm at the office, the home, or in the hospital. In the office, I can have access to the patient's hospital chart and get information about their last ER visit or hospitalization while they're sitting in the room with me. So I can have pretty much quick access to their chart. At home, I can do the same thing. I can have access to their chart. If the patient's admitted to the hospital or even in the emergency room, I can find information quickly and make decisions a lot sooner than I would if I had to wait till the next morning to get to the patient's chart. The HIT tools can help the patient in a few different ways. One way is I can spend more time with the patient. I can bring my laptop in the room and look up the x-rays, the lab results, vital signs, all things we do at a patient visit. But instead of doing it outside of the room and then walking in the room and spending a couple minutes with the patient, we can actually bring the laptop and the computer and I can go over all the results with them as I'm looking them up. And then while I'm in the room with the patient, you know, it's kind of more of a dynamic conversation. If they ask me what their blood count was, I can tell them exactly what it was. I can punch up their x-rays and we can talk about what the consultant said and have the exact information right there, and even sometimes show them the x-ray, the chest x-ray, which people just kind of love that, to see their actual chest x-ray, how it improved. And so it can help me in a lot of ways, and the biggest way I think is spending more time with the patients, and at least the perceived time. The patient can see the time we spend with them, so the 15-minute office visit turns into 15 minutes with the patient, not 12 minutes outside of the room and then 3 minutes inside. Before e-signature, to sign off on a patient's chart, you have to go down to the file room and have them pull the patient's chart, which would be multiple charts, and you'd have to go down there and then sign them off and hand them back. Now I can just do it on my own time, whether I'm in the hospital or not. So I can do it at home or in the office and do it around my schedule as opposed to having to be at the hospital to sign off on the chart. With the office EMR, we can take it home, so I can finish a lot of charting in the evening. You know, when a doctor finishes, even though he works till 5, he doesn't leave at 5. Typically there's a good half an hour, 45 minutes of charting to be done afterwards. So instead of having to stay in the office till 6 o'clock or 6:15, I often can just pack up my computer and leave at 5:30, since I coach my kids in baseball, basketball, and soccer, and most of the practices and games seem to start at 6 o'clock, so I can get out of the office, get home by 6. And then in the evening, after the kids go to bed and things settle down, I can pop out my computer, finish up with the charting, all the paperwork that we always have to do. And so that really helps out with my personal life and home life too, to be able to do these kind of things and make it to these kind of events.